So today I'm going to explain about the antidiuretic. So first, what is antidiuretics? It is the drugs that decrease the urine volume. Okay. And what is ADH? ADH is an antidiuretic hormone that is released from the posterior pituitary. So from the posterior part, two hormones gets released. First one is vasopressin, second one is oxytocin. Okay. So this both has the different functionality, but it is made up of the same amino acid sequence. Okay. And oxytocin is the uterine stimulant, we know that thing. And the vasopressin and oxytocin both is a nonopeptide which has the 9 amino acid sequence. In the structure there is a 9 amino acid of the both the vasopressin and oxytocin. Okay. And mainly vasopressin acts as a antidiuretic hormone, more because oxytocin acts as a uterine stimulant and vasopressin acts as the antidiuretic hormone. So coming to vasopressin, this is the structure of the 9 amino acid sequence which I said, nonopeptide. So vasopressin is obtained from two sources. First one is human source, second is porcine, that is pigs. Okay, the first one in the human source, in the 8th position of the amino acid sequence, there is arginine. Understood? There is arginine, which for the because of the 8th position arginine, it is known as argipressin. Okay, and from the vasopressin that is obtained from pigs, in the 8th position there is lysine, LYS, not arginine but lysine. Because of that reason, it is called as lypressin. Okay, so argipressin and lypressin both shows the same activity, but because it acts on the vasopressin receptors to produce the antidiuretic activity. Fine. So now coming to the synthetic vasopressin, there is desmopressin and terlipressin. Desmopressin is the analog of argipressin. As I said, desmopressin is the analog of argipressin. There is in the 8th position there is arginine, so argipressin. Okay, it is the analog of the argipressin. And terlipressin, it is the analog of lypressin. In the 8th position of the terlipressin amino acid sequence structure, there is lysine. Fine. Now the advantage of desmopressin over the vasopressin. Now we'll see vasopressin has got two limitations. The first thing is not suitable by the oral route. Okay, and the second one is short duration of action because of its metabolism. But in the desmopressin, we will see desmopressin is given by the oral route and it has long duration of action. So advantage of desmopressin over vasopressin is this following. So now coming to terlipressin, it is a prodrug and it has a long duration of action. Okay, and it has a more vasoconstricting effect compared to the antidiuretic activity. Fine. Now coming to mechanism of vasopressin, like we'll see how it acts. As I said earlier, it is a natural antidiuretic hormone. Okay, and it acts from two types of vasopressin receptor, acts on the two types of vasopressin receptor. The first one is V1 receptor, second one is V2 receptor. And furthermore, V1 receptor is subclassified as V1A receptor and V1B receptor. Okay, so V1A receptor is present on the vascular smooth muscle. Fine. And it is responsible for the vasoconstriction. Okay, it is present in the vascular smooth muscle, V1A receptor, and it is responsible for vasoconstriction and increase force of contraction, that is positive inotropic action. Fine. And V1B receptors mainly it is responsible for increase of ACTH release, adrenocorticotropic hormone release. Okay. And now coming to V2 receptors, V2 receptors has the main antidiuretic activity. So further I'll explain only the V2 receptor, how it acts on the all the mechanism I'll explain. And V2 receptors are mainly present in the collecting tubules, CT, collecting tubules. Okay. So now we'll see the antidiuretic activity of vasopressin through the V2 receptors. This is the collecting tubules, and here is apical membrane and here is basolateral membrane. Fine. Now at the collecting tubules, there is apical basolateral membrane. Fine. And whenever osmolarity is increased within the plasma levels, whenever osmolarity is increased within the plasma levels, it stimulates the release of vasopressin. Let's take an example. This is vasopressin, the black dots. Okay, and this acts on the V2 receptors. Here is the V2 receptors. The V2 receptors is a G protein coupled receptors with 7 transmembrane unit. Here you can count 1, 2, 3, 4, 5, 6, 7. 7 transmembrane unit is there. Okay. So further they are coupled with 3 subunits, that is alpha, beta and gamma. So these are the subunits which are coupled with the V2 receptors. Okay. And as I said, vasopressin will bind to the V2 receptors. This, like I have explained, the black dots, it will bind to the V2 receptors and activates the alpha subunit. Okay. And after the activation, it will stimulate the adenylyl cyclase. Okay, it will stimulate the adenylyl cyclase, and furthermore, because of that, it converts ATP to cyclic AMP. Okay, and because of the increase of the cyclic AMP levels within the renal tubules, it stimulates the protein kinase A, okay, which is a phosphorylating enzyme which produces gene transcription and protein synthesis. Okay, and which produces further, like aquaporins is produced after this, after the cascade of protein kinase A, the aquaporins is produced. Okay, and because of that reason, it is released and arranged on the apical membrane responsible for the absorption of water. So these are the aquaporins, and these are released and arranged into the apical membrane. Okay, apical membrane, which is responsible for absorption of the water. Fine. And the water molecules gets reabsorbed into the, like, this is the water molecules I have just explained. Like, let's take an example. This is the water molecules. It will get reabsorbed from the apical membranes. Okay, apical membranes, and because of this reason, it will get released into the systemic circulation. Fine. And because of that, the osmolarity decreases within the systemic circulation. Okay. And now, thus, vasopressin can increase the water reabsorption by increasing the expression of the aquaporins on the apical membrane of collecting tubules. Fine. So now let's see the is it clear, or should I explain again? It's clear. So side effects, coming to side effects, the first one is chest pain, agitation, anxiety, bradycardia, tachyarrhythmia, myocardial ischemia. Myocardial ischemia is the main side effects, okay, of the vasopressin. So these are the cardiovascular side effects. Okay, but others are hypertension, back pain, nasal congestion. Why this chest pain and agitation is there? It is because there is in V1A receptor, there is responsible for vasoconstriction, no, and which increases the force of contraction and the all inotropic effect. Because of that reason, there is a cardiovascular events. Okay, and now coming to vasopressin is normally not given. Desmopressin is more preferred, that also through the intranasal route. Okay, intranasal spray we get, through that it is more like useful. Desmopressin is more used in the recent scenario. So clinical uses in for the V2 receptor, desmopressin is used, preferred, like drug of choice, because it increases the absorption of water. It is used in the diabetic insipidus and nocturnal enuresis. It is bedwetting. It means like it has the loss of control of bladder in the night, during the night time. Okay, and for V1 receptors, terlipressin is more preferred. Because it has the vasoconstricting activity. So here we can say desmopressin is used mostly for the antidiuretic activity. Okay, and terlipressin is mostly used for the vasoconstricting activity. Fine. And V1 receptor terlipressin, it is used for the esophageal bleeding, because it controls the bleeding by contraction, vasocontraction. Okay. Others includes, other drugs are natriuretics, that is thiazides, amiloride. Thiazides normally it's given for in the diabetic renal diabetic insipidus. Okay, thiazides is more preferred than desmopressin, right? Because it has the efficacy is low, but it is more preferred in renal diabetic insipidus, and the dose is 25 mg OD or BD. And in miscellaneous, carbamazepine, indomethacin is there. And now coming to dose, further I'll explain in the therapeutic, this one later on will guidelines and all will explain, but for now I'll just explain the dose for here. For vasopressin, in subcutaneous route, 5 to 10 units BD or TID is there, and for desmopressin, as I said, IV 4 mcg per ml solution is there, and for intranasal spray is there, intranasal spray, which is very effective. So in the current scenario, only this is like it is preferred, mostly it is preferred in 5 to 10 mcg OD. Okay, and for oral route, 0.05 to 0.2 mg OD. That's it.